Welcome to My Nurse Specialty, a podcast for nurses who want a clearer view of what's possible in this profession. Real nurses, real stories, and real possibilities. Hi, everyone, and welcome to the My Nurse Specialty podcast. So tell us your name and what is your specialty?
Hello, everybody. It's so great to be here. My name is Jessica Smith Dos Santos, and my specialty is ER. I am an ER nerd, and I'm so grateful to be here to share more with you guys.
I'm so happy that you're here, Jessica, because so many nurses, that's where they say they want to start. So I want to talk about, how you got here and what it was like for you starting out in but when you started that specialty. So first of all, did you always know when you got to the ER that's where you wanted to be?
No, as a matter of fact, I got to the ER kind of by default, and we can talk a little bit about that. But I kid you not, I cried almost every shift for like a year before I decided I was going to be okay and made the decision that I was going to master every role there was to master and really settled into enjoying it.
So that's a good ad. I mean, it's a lot of newer nurses. I think that's pretty typical that they get into something and it can be overwhelming. So,
And
the learning curve in ER is probably fast paced and so much to learn. So, that's understandable that that happened, but it's not everyone's journey, but thank you for being so transparent about that. And you got there by default. So tell me a little bit about what that default looked like.
yeah, absolutely. So I had been a nurse for 5 years. I had worked on a telemetry unit, and then I went to a pre and post procedure unit. If I may put in a plug for tele, I think tele is a great foundation for a brand new nurse. Like, it's enough to teach you those like time management skills, and the patients are just complicated enough to like grow your knowledge and your practice. And it's an amazing foundation. And then I went from there and I went to a pre and post procedure unit. It's actually a really simple, like, prep and recover. It was busy, but not a lot of acuity. It was a great place to get a bachelor's degree and make 2 babies, which is exactly what I leveraged that season in my career for. And they actually decided that they were going to be shutting that department down. It was right in 2010 because it just wasn't making money for the hospital, but they wanted to retain us. And I was very big pregnant with my second baby. And they were like, "We would like to retain you. Where would you like to go?" And I said, "I would not ER be fun." Not even realizing that RER was 95 beds. It was a level 2 trauma center, like super high acuity. We were the stroke center, the trauma center, and the cardiac heart attack center for Northern Nevada, Northern California, and parts of Utah. So I raised my hand for a really intense ER, huge pregnant. They told me in one day that I was losing my job. I had an interview set up 3 hours later. And like an hour after that, they told me I was hired and I could have any shift I wanted. Of course, I chose day shift, but it should have been a red flag because I'm like, I have no critical care experience. I'm about to have a baby. I've been in this like super easy, cushy, job role for the last 2 years. And you're like, awesome, you have an RN behind your name and a pulse. Come on down. They had just had like a mass exodus, and I knew not what I was signing up for.
Oh,
Like,
wow. That is
like,
by default then for sure.
yes.
But you do bring up a good point because I've talked to so many nurses that, just getting in, and also a lot of us that have been around for a while. And sometimes we do talk about those opportunities that just kind of show up,
Mhm.
and like recently there was a nurse that was a door was open for her and she just wasn't sure if she wanted it, but her and I had spoken, and sometimes when those opportunities show up, if you don't take it, you don't get it again. So even though it started off on a rough road for you, it sounds like at that point too, you could have picked somewhere else as well, but that's how it worked out. So that does happen in nursing. I actually was involved in that myself, where I was working a unit and they said, "Where do you want to go?" And I actually went to case management. And I know actually a nurse who just retired. I remember she was a colleague friend of mine and she picked recruiter and she became a nurse recruiter, just retired as a nurse recruiter after 30 something years. So those opportunities do happen in nursing. And so kind of maybe be ready, like, where would I want to go if this unit was to close down in this hospital, right? Because things shift.
Well, and also be ready for like my sister's story is a little different. Like she's a labor and delivery nurse, but had no interest and no intention of ever being a labor and delivery nurse and just ended up in a small community hospital. And that's what they needed. And she was new and she's like, sure, why not? And she's been in love with it ever since. So, I mean, there's also those surprises where you're like, no, but okay.
Yeah, that's good. Those do happen, so be prepared, but you're in a very good position to talk about what you think would have been helpful for you in starting for the ER, or for a nurse who wants to go into the ER, that's really where they wanna go, what they should know.
Yes. So what I have learned since then is that there are different levels of ER. So there's like a level 1 or level 2 trauma center that or a level 3 trauma center, like they take in all the gnarly stuff, right? Like figure out what kind of experience you want. Like, are you a trauma adrenaline junkie? Do you want to be dealing with a lot of codes, a lot of heart attacks, a lot of stroke protocols? Like it's like drinking from a fire hose, stepping into that environment as a brand new nurse, and I trained a lot of brand new nurses in that environment. It is not easy, friends. It wasn't easy for me, and I had 5 years of experience, and some of it was on telemetry. There's also I ended up leaving nursing for 5 years. I got really burned out, and I was like, "I am done with this profession." And then 5 years later, the ER is like, "Hey, girl." And I had a girlfriend, I had actually trained her as a brand new nurse, and she was now a nurse educator in an ER near where I had moved. And she's like, hey, we have a day position open. Why don't you apply? And so I got back into nursing. That ER was not a trauma center. It was not a stroke center. It's not a heart attack center. It was not a Baker Act receiving facility for those psych receiving patients. And it was a much better experience because I got to like relearn that patient flow, and there were just enough high acuity patients to like really stretch me back into those high acuity skills, but not on a day to day. Like in the trauma center, I mean, I participated in a code at least once a week and I only work 3 days a week. Right. Whereas in the other place, I worked there for a year and I participated, I think, in 5 codes in a whole year. So there are very different levels of ER. And if you are brand new, I would recommend seeking out sort of a lower acuity, non trauma, non heart attack to get your foot in the door and get 1 or 2 years of good experience there and then make that leap into that higher acuity because it's difficult no matter how much experience you have and especially if you're brand spanking new. I would say the only caveat to that is if you're already a paramedic or a firefighter and you're running on a rig and now you've been a tech in an ER and now you're getting into nursing that way, I'd say that would be the only sort of caveat that would be an easier transition.
Yeah, definitely good points. I know too, working at a teaching hospital is different than, a smaller
Yeah.
community hospital or even a university, hospital that they do have a lot of residents and interns that float through. I know there's a
Mhm.
lot of spotlight right now on because of the show called The Pit. So,
Mhm.
yeah, have you seen
Mhm.
it?
So, full transparency, I watched like the first 3 episodes and I'm like, "Oh, hell no, I am not reliving this in my living room." Like they did a really good job. It was quite realistic. And I was like, "No, I'm good. Been there, done that."
Right, right. No,
Yeah.
and it's
Yeah.
different than a lot of the medical shows that have been on TV. And I did the exact same thing as you. I actually watched a couple episodes and I had like PTSD and I had to turn it off.
Mhm.
And then
Mhm.
my kids started watching it And so I started watching it with them, and then I was able to watch it, and so I did get through the
Mhm.
first season, but I was telling them, this is not every ER. And so it's good for
Yep.
people to know because if you got young nurses or people who want to be nurses or say one day they want to be in an ER, it's good to know
Mhm.
that there are different levels of ER and that one
Yeah.
is a university teaching hospital, which has a
Mhm.
lot of pros to it as well. Especially if you did want that and started there, like what you did later, moving into a different level afterwards would be easily able to do. It's
Mhm.
important to know that yes, there are different levels that are out there. Not one ER is the same as another ER.
Correct. And also recognizing that if you get into one ER, like I ended up falling in love with pediatric ER. When I went back after my 5-year hiatus, there was an opportunity to grow my pediatric ER nursing skills. And I remember the first time the doc was like, "Hey, I need you to start a line and draw labs on that 1-day old." And I was like, "Excuse me?" I was like, I could drop a 16 in an IJ in a hot second. You want me to do what with that little thing? So, I mean, I got that opportunity to really lean into like pediatric ER nursing. And I just found that I fell in love with it. And I found a whole nother groove that I didn't even know that I didn't know. And it was a really cool experience.
That's great. That's another again for nurses to know that sometimes you don't know you don't love a place until you really kind of got into a place, right? So, especially I know people that work with adults and then switch over to kids and vice versa, you know, maybe because you haven't been exposed to it, you just don't know. So sometimes allowing those opportunities is a good reason to see whether you really love it. It's really hard as a nurse trying to figure out where you want to go, which is the whole purpose of this podcast. But because we'll tell you, shadow. Well, I've shadowed before in areas and got the job and hated it. So, that isn't always even going to be a good, true indicator whether you're going to like something
Mhm.
or not.
Yeah. My friend Kelly and I, we kind of have a professional rule for ourselves that when we get into a different role, we give ourselves a year because it gives us enough time to get over that hump of like, this is uncomfortable. I'm new. I don't know what I'm doing. I don't like this skill. And then you kind of settle in and you're like, okay, I'm over that. Like, I'm new hump. And then by the end of that year, like you've mastered some things. And then you can really decide, like, is this for me or not? Because you can toggle back and forth. Like, I hate this, but why do I hate this? Do I hate this because it's pushing me and it's uncomfortable? Or do I really like this is not a good fit for me? And it takes time to really figure that out. So if you're gonna commit, I would say commit for a year. Plus, it just looks better on a resume when you give a place a full year rather than jumping 3 months and 6 months and 9 months. And it just shows people you're not dependable. So and you can speak to a year saying, I gave it a full year and I discovered that it just wasn't in alignment for me. And I'm looking for my forever fit. That looks a lot better on a resume.
It does, but I do know that there are nurses who absolutely know they can't do an area and that year just seems like forever. And so I think you really do have to weigh it. Like, can you do a year or can you really not do a year? And if you can't do the year, I think that you can maybe not even, really talk too much about that job.
Just leave it off the resume.
Yeah, leave it off. If it was a couple weeks, you definitely don't need it on there, right? Yeah, it's hard to explain a 6 month, type of, or even a 3 month, but when you have a gap in employment. But yeah, it is good. But I think what you're saying too is really deciding why you don't like it because you had mentioned that. Is it a skill? Is it, what is it that I don't like about this that I cannot do that year? So
Mhm.
there are there are situations where don't do the year if it's your mental health, right?
Absolutely. Absolutely. And then that becomes a conversation of like, let's get really intentional about why you're choosing what you're choosing to begin with. I think that's a whole other conversation.
Is there any like if somebody, really does, let's say, like you said, maybe they did the ER when before became a nurse, in some kind of tech capacity or something like that, or someone who just really knows they want to get into the ER and they're brand new nurse, maybe worked a year in some other area and they still want to get into the ER. What certifications would you say they should get prior to applying?
So this day and age, a lot of ERs will take you and give you 30 days to get what you need. And it depends on what type of ER you're applying to. So if the ER takes care of pediatric patients at all, you do have to have either PALS or ENPC. Most places accept PALS. You do have to have ACLS and BLS. If it's a trauma center, you are going to be looking at getting your TNCC, your trauma nurse certification at some point. That's going to be important to be a part of a trauma team. Every ER has to do specialized stroke training. So, looking at that NIHS training, and a lot of places they will provide that training for you and they give you a certain timeline. So, I remember when I first started ER, I had ACLS and BLS. They gave me like 30 days to get my PALS, but they offered it through the hospital. And then I started trauma training. So then I got my ENPC and I got my TNCC, my trauma nurse certification. And then I took the professional aspect to a whole new level and did go on to get board certified as an ER nurse. That is not required, but it's also an additional level of once you've decided where you're going, consider getting certified in your specialty because it'll just take your professionalism and your knowledge kind of up that next notch. So, those are kind of the few things initially that you would need depending on what ER you're in.
Yeah, those are really good things to mention. That certification too, that like all the specialties have, certifying that you are an expert in that specialty as well.
Mhm.
Definitely, it's great for if you wanted to move up within the ER. So tell me a little bit about opportunities that you got to the ER, you're working in the ER for a while and you want to stay in the ER, but you don't want to just stay being on the actual ER, just being the nurse in the ER. What other opportunities are available to a nurse who gets into the ER and has opportunity to move either laterally or up?
So, initially, when I finally decided that I was staying, I was like, okay, what are all the different roles within our ER? Because that ER had a yellow pod, which was more like kind of our urgent care, like our fast track area for people that, had a sniffly nose or a stub toe, those kinds of things. We had a green pod, which was more psychiatric specific, plus a little bit of medical stuff sprinkled in, but lower acuity medical stuff. And then we had our blue pod, which was our trauma pod. So they would come in as a trauma, go through our trauma process in the trauma bay, and then they would be delivered to the blue pod after that part. We had the red pod, which was our high acuity pod. So lots of codes, lots of intubations, lots of sepsis, really, really sick patients. So our ratio was a little bit lower. It was like a 1-to-3 ratio versus blue pod was a 1-to-4, green pod was a 1-to-5. So they looked at that. They also had the triage role. So being out front and like accepting those patients coming in. And then they had the trauma role. So they had a trauma team lead, but then they also had a trauma team that would respond to those traumas. So all of those roles are kind of lateral within the department that you could consider mastering. Oh, and they also had a pediatric ER. So you can kind of look at doing all of those things in the ER that I started in terms of lateral moves. But then you would look at that additional training to become a charge nurse. So a trauma team lead was a step up. A charge nurse was a step up. So being in charge of a 95 bed ER and all the traffic and all the staff challenges that come with that. That ER also had a leadership structure where they had a few supervisor positions, a couple of manager positions, and then a director position. So those were all like climbing up that ladder of hierarchy. So those are all of the things that were available in terms of the ER. And I just decided once I decided I was staying, I decided I was gonna get good at all the lateral things, and then I was gonna go for charge nurse and see how it went.
Yeah, and you always still have options, and if it's just if you decided to stay in ER, where would you go? And it can also be ER is a good stepping area for other opportunities as well. I think we have what, flight nursing, I think sometimes is a good spot for that, or do you know any other ones?
Flight nursing is good. I know that depending on the area you live in, they have concierge medicine, they have sports medicine, they have rodeo medicine. So it's more of like those trauma based nursing roles for events. Like those are all things to consider. Another thing to think about is a lot of ERs these days also have an offsite freestanding ER. So the first hospital that I worked at didn't have that, but the second ER that I worked at did. And it was a freestanding ER, so it had a CT scan, ultrasound, X-ray, lab, EKG, all available on site. And then we had the ability to transfer to our main hospital for admits, and that's an interesting beast all in itself. Like, it's less staffed, like, the one that we ran had 10 beds, and it was staffed with 2 nurses, a doctor, and a tech. And so, I walked in one morning and there's a patient having an FT elevation MI who looked absolutely horrendous. And they were like, "Oh, we're waiting on the transport. They're gonna be like 15 more minutes." And I picked up the phone and called 911 and had the fire department come get him. So it's just another aspect of that emergency medicine.
Wow, yeah, that's a lot to opportunities that you can do with it with that, 'cause you think about it, yes,
So
about
many.
right, so many. Okay, is there anything you wanna add that we didn't talk about or
Uh, yeah, sure. I would also say now I am per diem bedside ER, like a couple of shifts a month to keep my skills up. But now I'm an emergency room nurse educator. So that's a completely different role. I don't do patient care in that role. My role is more of supporting the nurses with their competencies or if they're making errors, like what's going on and how can we support them in being more successful. For the new ones, it's like helping them, at the bedside and helping them with their knowledge and just helping them grow that critical thinking. So it's like an ER adjacent, right? It's still ER, but it's another role that you don't think about when you're thinking, I want to get into ER.
and I'm sure that your certification really helped you with getting into that position too.
It did. It was something that was on the resume, but I didn't keep it up. So I could say I was board certified at one point, and now I'm actually looking at going for board certification as an educator.
Okay.
So something different.
Yeah, there's always something with nursing for sure. Okay,
Absolutely.
so for fun, I kinda like ask this last question, and it's so I'm just gonna have you finish the sentence. And so it is, "My nurse specialty is great for nurses who"
Who like high adrenaline, who have high energy, who love to learn at a fast pace, and who are willing to hit the ground running every single day,
ready or not.
ready or not.
Okay. Well, thank you so much. Is there anything else you wanna share then?
What I would say is if you are considering emergency nursing and you are a brand new nurse, I think it's really, really exciting. And it's a steep learning curve, and it can feel like you don't know what you're doing for a couple of years. So if that's the route you choose, it is entirely possible, but be prepared to feel like you don't know what you're doing and to be challenged every single day for at least a couple of years if that's the road that you're going to take.
Yes, that's so important. I'm so glad you kinda mentioned that because I'm sure that when you're a new nurse, you're going through this, and to know that that's actually normal to feel like that for possibly 2 years. That's we I always used to say, or I do say, that there are certain things that you can only do by going through. You can't go
Yep.
under the experience, you can't
Yep.
go over the experience, you have to go
Nope.
through the experience. And
Mhm.
just know that you are in the current stage of experiencing it in a new specialty that you wanna be in and thrive in.
Yep.
So
Yeah,
Good.
just setting that realistic expectation. Be prepared to do hard things, and it's possible.
And you can love it if you decide that's where you want to be.
It took me a year to decide I loved it, and I had
Even
5
through
years
the
of
tears.
experience.
Yes.
I
Even
did.
through the tears.
Yes, exactly, exactly.
Okay, thank you so much for being a guest on the podcast. I'm sure that you have helped so many nurses that are excited to actually probably hear this episode because they do want to be an ER nurse. And I'm really happy that you shared, some of the pains that go with it and what you need to do to be in the specialty.
Yeah, absolutely. It was my pleasure. And to all of you out there listening, best of luck to you. You are our future, and we are so incredibly excited to welcome you into our profession.
Yes, yes. All right. Thank you again. I hope what you heard today gave you real insight into this specialty and helped you see what's possible for your nursing path. Please subscribe so you don't miss what's next. And tell me, what specialty should we feature next? If you're a nurse in a unique specialty that you'd love to share, apply to be a guest on my website. I'm Coach Rebecca. Until next time, keep exploring.